Okay, we still have folks coming in, but I think we can get started. So welcome everyone to the second Implementation Science Beachside Chat. My name is Allison Hamilton and I lead the UCLA Rapid, Rigorous, Relevant, or 3R Implementation Science Hub. And I will be your host today, along with my colleague and co-investigator, Dr. Chen-Chin Ling. So happy to have you with us today, Chen-Chin, to enhance our conversation. So thank you so much for being here. And it's my very, very, very great pleasure to introduce Dr. Anna Baumann. We can go to the next slide if you don't mind, Chen-Chin.
Do you see the next slide?
I do, yes.
Okay.
There it is. We're so excited to have Anna with us today to talk about equity and implementation science, a practice, a process, and an outcome. Anna is a research assistant faculty at the Brown School of Social Work at WashU in St. Louis. And she also co-directs the Dissemination and Implementation Research Core. Anna and I go way back to over a decade ago during my time at WashU through the Implementation Research Institute. And it's just been, a great pleasure of my career and life to continue working and collaborating and knowing and learning with and from Anna. And so we're so happy that she was able to join us today and able to be one of our illustrious consultants on the UCLA 3R Hub. And we just super excited about this conversation. So we're going to get started as we did last time with just a couple of quick poll questions, and then we will start our chat. So next slide, please.
Okay, go to the first poll question is, do you primarily work in academia, government, nonprofit, industry, or others?
I think you're gonna see the results.
I don't.
So Elena, are you seeing the results? There we go.
Okay. Yep. I see them on my end.
Okay, we've got them. So we've got most folks in today's audience from academia and a handful from government and from nonprofit as well. Thank you so much. And then we have two more poll questions for you.
Let me go to the, hold on. Oh, okay. So second question is, do you consider yourself an implementation scientist, an implementation practitioner, or interested in learning about implementation science, or interested in learning about the practice of implementation?
Just take another couple seconds.
Okay.
Oh, cool. So we have more than half are interested in learning about implementation science. Slightly less than half are implementation scientists. And about a quarter are interested in learning about the practice of implementation. Great. So should we go to poll number 3?
Sure.
Hold on. Okay. So poll number 3, what's your experience with equity research? You can either be a novice in the equity research conversation or intermediate skill in the context of equity research, or advanced skills in the context of equity research. Okay, 57% consider yourself as a novice in the equity research conversation. About 1/3 as intermediate. Okay, so
just a few with advanced. Would like to one day feel advanced in this topic. It's always a learning process. All right, well, thank you so much for your responses to the polls. That's really helpful for us as a context for knowing a little bit about our audience. And I think we can come out of the PowerPoint for now, Chen-Ching, and
yes.
start chatting. Thank you. So for anyone who hasn't joined us before, first of all, welcome to those who are back for the second Beachside Chat, and welcome to those for whom this is your first Beachside Chat. This is really meant to be a chat. It's not a presentation. It's not a super formal process. It's talking about issues that we're addressing in implementation science with experts in the field, people doing really cutting edge work such as Anna. And so we have a few guiding questions, but we're also really interested in questions from our audience. So I'm going to pose a question to Anna, but feel free to, add your comments and questions into the chat. We'll also keep an eye on that and bring in your questions, to whatever extent you have them. And I'm guessing you will have a lot. So again, so excited to be here with Anna and Chen-Ching, and I'm just going to get us started with a question that I really want to talk about with Anna. So it was great preparing for this because I got to update my knowledge of your work. So you wrote a recent commentary in Frontiers in Public Health on adapting and operationalizing REAIM for implementation science in environmental health. And there are some really amazing points that you make that resonated a lot for me in this paper. So there was one suggestion that you made around the idea of needing to be humble with our frameworks. And I thought that was just amazing. I haven't heard that point be made. And it really got me thinking. And you talk about how we need to, or you write about how we need to be careful in our definitions to avoid ethnocentric bias. And I think I'm actually going to stop there because that's a lot to talk about. So I want to hear more about what that means for you in terms of being humble with frameworks, avoiding ethnocentric bias. Folks might not even know exactly what that means. So if you could maybe spell that out a little bit and what your thinking is and where you're coming from with those suggestions. And welcome. Hello.
Hello. I love chatting with you. And I loved your question because I don't know what I wrote. What did I say?
Did I say that?
Oh, so I will say that I'm looking at the list of people, and I do know that several people here also do equity research. So I hope that the chat is not just questions to us, but also conversation among all of us, because I always learn with others as well. I am on the intermediate level knowledge of equity research. So let me give you a couple of examples to talk about what I think is a challenge that we have in the field right now, right? So frameworks are important, they're amazing. We need them because they have constructs. Constructs helps us measure, helps us do all the things that we need to do in terms of theory and frameworks, right? The problem is that those frameworks were developed for high income countries, for us, by us, right? And so when you take those frameworks out of that context and take them to places where they might or may not have the same resources, some constructs do not fit, right? So the example on the Riain paper was around, say, it was a paper around fuel, right, and stove. And so, for example, when you think about reach, and when you think about reach in the context of parks, and when you think about reach in the context of driveways, right, how do you, it's like some concepts just do not fit. And that could be true for not only low-income countries, but in different settings, right? Because a lot of the frameworks that we've developed are for healthcare settings. But the problem is when we take frameworks that do not necessarily spell out things like infrastructure, things like organization being flexible, not necessarily organization the way that we talk about it, they also don't fit in low resource settings. So a couple of examples, when we took Parish to Rwanda, and we talked about facilitation and we talked about intervention, an evidence-based intervention, it's not just a manual, right? It entails a whole nother setting of resources, of how do you check for fidelity? How do you provide, say, syringes? How do you train people? And our frameworks are not necessarily spelling those things out.
Mm-hmm.
And so when we take it to different settings, it just doesn't fit, right? So that is in the context of resources. Another example that several of us, and I know that a number of them are here in the call, is mapping frameworks from implementation science with social determinants of health. So to give an example, we have a pilot study that we used CIFR. So CIFR, right? It's a pre-implementation study. We wanted to go in and say, would you be willing to do this evidence-based intervention? We developed the guide. We were like, okay, we got it. We interviewed several people. We took a look at the data. Nobody talked about intervention, organizational capabilities. Nobody wanted to talk about those things. They talked about all social determinants of health.
Mm-hmm.
So one of the things when we talk about equity, right, and Eva's work has been, I think, inching even more forward to those, is that social determinants of health are silent in our frameworks. Infrastructure is silent. Resources are silent. And we need to do a little bit more, a lot more work in spelling out the context of what does it mean to implement evidence-based interventions, especially when you talk about low resource settings.
Mm-hmm.
So that is my.
Well, and that actually really speaks to the other point, one of the other points that you make in the paper about what is context and how does context kind of affect these definitions that we use, the evidence that this is a little bit of my words in there, but the evidence that we, prioritize, and who is judging the value, the evidence, the context, et cetera. And I think that really speaks to your point about paying attention to ethnocentric bias and how, these components of what we're, very much in the business of looking at are really shaped by our worldviews, and most of that work has been done in that Western context. And I think as an anthropologist, that point just really kind of sang out to me, like, oh yes, we do need to be talking about this a lot more. And I think that maybe, I don't know what you think, but I think that may be a great sign in the development of the field too, that we're at a place now where we can be much more critical and reflective about these aspects of where we came from and where we need to go.
I hope so, because it's tied to everything, right? It's tied to frameworks is just a piece of the puzzle, right? But how do you select interventions? What is really an evidence-based intervention, right? Evidence by whom? And so when you talk about evidence-based intervention, you need to have some way of measuring, right? And for example, and we've published about this in parent interventions, if you do mental health and parent interventions, you are aware of CBCL, which is my nightmare, right? So CBCL is like this big measure. It's fantastic, it's great, but it's expensive. And it entails a software. And so when we took it to Mexico, the first round we had money, we were able to use it. The second round we didn't have money. So it was like, how do you even implement an evidence-based intervention if you don't have how to measure it, right? So I think we have to sit down and really think about what it means in implementation science to implement evidence-based interventions to close the quality gap, because there's a lot of assumptions in that sentence that I don't think we're really talking about it.
Yeah, absolutely.
Yeah,
Shane, were you going to add something? Yeah, go ahead.
Yeah, I do have a question about measures. When reading your article about equity and implementation science, you talk about the lens of for measuring intervention outcomes. So just want to get your insight that how do we evaluate health improvement outcome among some of the represented population, for example, those who only speak Spanish or new immigrants. I'm wondering if some of the standardized measures really applicable and culturally sensible to these populations. I don't think it's just a language and translation issue. It's more of like you need to do some of like a culture adaptation of the questions and the way it's asked. But then if you do change those questions, it might limit the capacity to do some like a cross-border comparison with some other groups, right? So yeah, just wanna get your insights on this measurement issue that I've been thinking about recently.
Yeah, measurement is a nightmare, right? And so I really want to give kudos to Kara, Louise, and all the group in terms of trying to define measures and thinking about pragmatic measures. So I will tell, even when you adapt, so we're using COACH, which I should know what it stands for. It's Anna Bergstrom's work. So she has developed, it's a long measure, it's a 59 item measure that she developed actually based on iParish and a couple of other frameworks for low resource settings. And the development of the measure was in 8 countries, because exactly what you're saying, right? It's like the measures don't fit, and how do you do? And I love that measure because it talks about things like informal payment. It talks about exchange, which happens a lot, and it happens a lot in low resource settings, right? But so we adapted. We translated, back translated, did the whole cognitive interviewing, the whole thing that we should do, right, when adapting measures. And now we have this measure, but then we don't have, it's not necessarily validated because we don't have, right, it's like, how do you compare it to what? So it's a catch-22, right? The valid measures can be expensive and not necessarily pragmatic, but then if you do pragmatic measure, what do you do? Hence, I'm going to give the hat to Allison, right? The mixed method. And I think the importance of qualitative research in telling the story comes in.
Right. And thinking about what we're not measuring, what's in between the measures and on the sides of the measures and in the in-between spaces.
Yes.
But yeah, it's really a big question. There's some really interesting stuff going on in the chat. So Christina said, I would also say another issue to be cognizant of is research centrism in implementation science. Organizations on the ground and health departments may not be able to do many of the things called for by IS, from a feasibility, resource, and person power perspective. And I'm going to skip your question for a minute, Joseph. I do see it because there's a follow along to Christina's comment from Claire saying that there's a growing ivory tower perspective to the science of IS. Being an implementation practitioner that has transitioned to IS, I do not want to solely pursue science that is not practical for routine health systems delivery, especially in low and middle income settings. So a lot there to think about. Any initial reactions, comments, thoughts, Anna?
Yes to all of that.
Like, yes, that's all.
Yes, exactly.
That's all correct.
Exactly. Yes. And I think we haven't done a really good job in really thinking creatively, right? So if you think about equity space, and if you think about historically vulnerable populations, they're not coming to the traditional settings that we're doing our work, right? So I would love to see more work in places like churches, libraries, barbershops, food banks. So if we are really to think about breaking down the system and doing social justice work, we need to do creative work, right? And I don't think we've been creative enough to do that. And so there's a question here about the community-based participatory, I cannot say things, community-based participatory research, which would inform a lot of that, right? Where are people going? Where are the places that are safe for people, right? So I think we need to really sit down and struggle with our uncomfortable feelings about we're not really closing the gap as we were set to do. And what is it that we need to do to actually effectively close the gap?
Mm-hmm. Yeah, I mean, to me, that some of that even comes back to some of your points, Chenching, about measurement, because when we expand the landscape of where we do this work and also extend it into CBPR, for example, which I think is a great development from my perspective, you know, it really, I think it makes us look more critically at how we've even conceptualized the spaces where implementation happens. And once we go into spaces where this work wasn't originally designed to, you know, imagine, you realize, oh, we don't, how do we measure organizational readiness in a church? You know what I mean? Like, what does that mean? What does an innovation mean in a park? What is it, you know? So I think it really, it pushes us outside of, you know, even though it's not an easy space, it pushes us outside of that comfortable space that we have developed of thinking about organizations and clinics and, you know, the walls around the places where we developed so much of the work that we do in IS. So I think, you know, it's exciting. It's definitely puts us in a whole other place and space and way of thinking about things. And I mean, for me, that's why I love this field, is that it's always kind of growing and saying, well, we thought we knew something. I mean, I think that's one of the main things I say when I teach this is, yeah, just be ready for everything you thought you knew to be questioned, to be smashed to bits, whatever it might be.
Yeah,
that's
the beauty of it. Yeah,
we need to be creative and adaptive along the way.
I mean, one of the things that this brings up for me too, in thinking about kind of moving beyond the places where we've been used to doing this work, is when you're doing equity work, and we've talked about this a little bit in other places, but you know, this isn't a neutral business. And I think when we start to really expand our landscapes and are willing to see injustices, which are right there, not hard to find, not hard to see. Like, to me, I keep thinking how hard it is to retain that, you know, I'm a scientist and I'm supposed to be neutral about this because I don't feel neutral about it. And I can't bring a neutrality to it. And you've written, you know, in your paper with Leo about bringing advocacy into implementation research. And I'm hoping that you want to talk about that. Like, what does that mean for you? What does it look like and feel like for you? And what do you think the implications are of an advocacy lens for science?
Mm-hmm. You know, when you asked that question, I went all the way down and was like, let me search how do people define advocacy again, because so let me, I would love to give you, if it's okay, a couple of examples of how that word and social justice word entered my vocabulary. And then we can talk about what we're doing now in terms of the anti-racism group, because I think those are different levels of advocacy. And I would love for the field of implementation science to think as advocacy as an implementation strategy and really, really outline what it means and how it supports evidence-based implementation science. So those papers are published, and actually the title of one of the papers is Social Justice and Scientific, how do you balance social justice and scientific integrity? So the context is, I'm from Brazil, this is real, but I speak Spanish because I lived in Chile. And so I'm giving you the geographic markers because as we do equity work, I've found that those things are important, right? As I was doing my PhD, I was working with Melanie and Dominic Rodriguez, adapting parent intervention from English to the Latino populations in Logan, Utah. So this is 2005. We were super excited using CBCL. That's how I know. So to your comment, right? So we had literacy, right? So we, as RAs, we would sit down with the parents talking about things. We would read the measure for the parents because, right, we had to let measures. So going back to your question. So this is an RCT, classic comparison testing to see if the intervention works, okay? December 12 of 2006. So if you are Latino and if you're involved in the Mexican community, December 12 is the Virgin of Guadalupe, the Virgin of Guadalupe Day. An ICE van stopped by the meat factory and, sorry, and got several of our families and family members detained. We were in the midst of launching a group. Okay, so now I ask you, people, what would you do? You need to launch a group, but your family members understandably do not want to leave the house because they're afraid. Not only they do not want to leave the house, but they call you because they don't have groceries. What do? Right? So I was at that time a student with visa. And so we had to have this conversation explicitly because immigration issues. And you know, it's all in the paper. So we've decided to do little advocacy. We pause everything, forget about scientific integrity, forget about data. In fact, we haven't even published the outcomes data because the data is so bad, right? We went grocery shopping, we went, you know, babysitting, we did everything until the families were feeling safe enough to go out and then recruit again. This is 2006 and still happens, right? So fast forward, our peers are doing, you know, parenting group in the basement of the church. And in fact, before they start any group, they have lawyers, immigration lawyers coming and have an immigration plan in case any one of them is deported. So this is happening, right? How do you not do advocacy if you're working with vulnerable, right, populations? You have to. How do you talk with parents to increase and be, you know, and praise their children if they're starving? You can't. So you need to feed them. You need to provide them resources. You need to provide the basic Maslow, right? Okay, now let's talk about parenting practices. So that's the little P that I would say. The larger P, so I went and I looked for what is advocacy and how are people defining? And I'm happy to send the paper because it's a evidence-based advocacy paper. And so the paper defines advocacy as a deliberate attempt to influence decision makers and other stakeholders to support or implement policies that contribute to improve health equity using evidence. So using your voice to support and push and influence the field, right?
Yeah, there are some related comments or questions in the chat. So first is from our colleague Dilara Uzkap. Her comment is that my frustration with this conversation is the lack of acknowledgement that scholars have color, have been in these spaces, operating, doing implementation science work in churches, within creative places, etc. for decades. How can we talk about centrism negate this?
Mhm. Yeah, Dilara, I, 100%. I am learning as I go a lot. And so again, as a Latina, right, and being in an ivory tower and being very embedded on my own work, I hear a lot of the frustration from the equity people saying, but we've been doing this. And I think it's part of us in the ivory tower and implementation science field that have been pretending that there's nobody else doing this work.
Mhm.
And we need to do a better, way better job in reaching out and learning from people that are doing community engagement, that are doing a lot of work out there, and actually not only collaborating, but giving space for you guys, for people to talk and teach us. How are they doing? Yeah.
Yeah, and she also mentions the
The
price
minority
that scholars.
tax. Yeah.
Yeah, yeah.
Yeah, absolutely. Absolutely. And it's a challenge, right? Because it is how can I learn with you without taxing, right? And so we can talk about the anti-racism group now, if that's okay.
Sure.
Yeah. So I will give credit to where credit is due. This is a group that started with an open classroom around implementation science. And we were, Rebecca Leibniz-Howe and I were supposed to talk about this is what implementation science is. But this last year happened the week after George Floyd was murdered. And so we felt very strongly that we needed to talk about this. Fast forward, we haven't built this group, we got together. It's a group that now we are about almost 300 people.
Wow.
Yeah. And it is a group that is explicitly focused on anti-racism with Black communities. So Lynn, I don't know if you can put the PowerPoint with the website of the group. And we're really making things up as we go. It's like there's no plan. This is completely group-based. We try really hard to listen to the community. And yeah, on this slide, there you go. So this is the website. I will say that it only has my name because that's the free website that we could put together. There's no, this is not me at all. This is a group that was built, with the community, the amount of wisdom and feedback that the community is giving. And so I want to give, shout out to the organizing team, to Corey Bradley, Nadine McClary, Atia Turman, Sarah Beth Brotherfingerd, Rachel Shelton, and Denise Long, who collaborated a lot. So you can see that we have in there, we have what is our mission, we have why we're specifically focusing on anti-Black racism. And in the tab on action items, we have 9 action items that were offered by the community in terms of what to do. And one of the action items is actually learning from equity researchers, from community-based researchers that have been doing this work for a long time, and have a literature review, a list of articles that we can learn and embrace of that. So yes to everything that you said. I guess that's what I'm saying.
Yeah, this is an incredible resource. Claire brought up in the chat, maybe prior to implementing EBPs, we should be doing a landscape scan to figure out what is already being done. There's a lot of work on the ground by community members, coalitions, CBOs that is not always recognized and valued by IS researchers. Perhaps these don't have quote research evidence, but they are acceptable, appropriate, and feasible. How do we elevate these initiatives and apply our IS lens to these community-driven projects?
Claire, that's my challenge as well. I don't know the answer to that. So, Lynn, I think we are okay. I will give you, so Allison Mertz, Betsy Wu, and others, we are writing a special issue. I think it's going to be published next month. And part of that special issue is on implementation science and equity are examples of exactly what you're saying. So of examples of people that, again, have been doing this work for a long time. And part of these are examples of how interventions are developed on the ground, from the ground up, right? And one of the things that they're questioning as part of this special issue is whether our evidence-based interventions are equitable interventions, right? Exactly because of what you're saying. A lot of the communities are doing a lot of work already. And perhaps the thing is not for me to go in and say, you should do this evidence-based parent intervention. It should be, let's evaluate and see how we can strengthen the strategy so you can sustain this evidence-based intervention that you developed, that works for your community. And I don't know the answer to that. I don't know how we can do better. Humility, I think.
Mm-hmm. Mm-hmm.
Yeah, so on a related note, I'm thinking some evidence-based intervention has to be implemented appropriately to actually reduce inequality. So yeah, a question that I've been thinking a lot is like telemedicine during COVID, right? So telemedicine, everybody know that it's booming during COVID to ensure a continuity of care and to bring care to distant area for people who are unable to commute during COVID. It come with a good intention, of course, but I'm thinking whether it actually increase or decrease inequity. Say, for example, like COVID right now, like COVID vaccine appointments are made online, right? So of course it's convenient and efficient for a lot of people, but that actually increase barrier for those who don't have access to internet technology, right? So as a result, that you see like African American people are less likely to be vaccinated with this technology. So just wondering, do you have any insights, comments on that?
This is challenging, right? Because I
Right.
love how you're bringing technology, like the telemedicine as an example. We were just looking at some data of an investigator here last week on the VA in the context of cancer. And so when COVID hit and then when telehealth happened, because people didn't need to go anywhere, there is a high rate of participation and engagement with the treatment, right? For those in the vulnerable population. But what happened is, because equity is not a one single construct, right? And because context is so complex, what we are seeing the other way around is then it brings the burden of people that do not have access to Zoom, that do not have access to phone, right? And so how do you engage people who are really perhaps the ones that need the most to engage? So I'm just, I guess, reframing your question and saying, I have no idea. Because you can use telehealth as a strategy to increase reach. But at the same time, if people do not have the infrastructure to support the telehealth strategy, right, you can actually increase inequities. So I think it's going back to really thinking about not only what is the ultimate goal or the proximal goal of this strategy or the intervention, but what are the contextual factors that would support that strategy or that intervention? Does that make sense? Yeah.
In our current NHLBI funded study of addressing cardiovascular risk and histories of trauma among Black and Latinx people living with HIV. We had to change everything due to COVID. And so the intervention that was once in-person, group-based, we now deliver via tablets. And so we were able to purchase tablets, but of course, that does not do everything. So they had to be tablets with Wi-Fi so that they could actually be used. And you know, some folks had not used this technology before. So there was training involved. There was, you know, making emails. There was making sure that the hotspots were working, making sure we could make them available for long enough that they would be of use well beyond the intervention. I mean, yes, it's been a great way for us to be able to try to get this intervention to folks who might benefit from it, but it really extended, I think, even to our surprise, how much of a difference it's made to be able to provide those and not take them back. We don't take them back. They are theirs to keep. What we've heard from our participants is that they've helped with so many other things. Like you said, Chencheng, making appointments, being able to do televisits, like the value of them expanded way beyond why we originally provided them, which was, you know, sort of, I mean, we hoped that they would be valuable, but we definitely had the interest of the study going on and wanting to continue providing the intervention. But it's really, I think it's made us so much more aware as a team of so many more issues than we were thinking about at first. Our own biases, of course, and also, you know, people's lived everyday experiences. And, you know, like you were bringing up before, where does the priorities that we have in that study and in our intervention, where does that intersect and not intersect with their day-to-day experiences, lives, needs, challenges, pressures, priorities, et cetera? You know, is it the most important thing to think about cardiovascular risk when you might not be able to put enough food on the table that night? And how do we kind of balance out, you know, the expectations that we have and prioritize as researchers when, you know, we're hearing about these extremely real, challenging circumstances, multiple losses, you know, and grief. I mean, you name it, we've all been hearing about it and experiencing it. So it's the humility that you talk about, Anna, the humbleness has been just profound, you know, just constantly profound in that process. We have a comment from Jason who said, speaking as someone who does telemedicine, your point is spot on. Poor communities, rural communities have less access to technology and high-speed internet. And so there's so much potential here, I think, as you bring up, Chencheng, and there's also so many things to keep such a close and critical eye on. Ethan asked, how do we disrupt the system in a way that there's an incentive to build up the knowledge? Oops, I lost the, to build up the knowledge that is based on communities, driven and developed by communities, as opposed to the current systems now, where the ones in the ivory tower are the ones that have the most to gain from these research activities.
Yeah, but I don't know. Because doing really true community work, it takes time, right? It takes a lot of time.
A lot of time.
A lot of
stops and starts.
Yeah, and it should, right? Because it's a relationship building, especially when you talk about historically vulnerable populations who have been, and I'm gonna use the word used in the past, right? So you need to really be careful about what you do, what kind of questions you ask, and how you engage with those communities, right? If you pitch that against, I'm not on the 10-year track, so in the 10-year track timeline for promotion, which is the coin is, right, publications and grants, those things do not align. They can't, right? I can't, it doesn't work. And so the system was not set up for this. The system is against this. There are a couple of solutions that we can go about, right? Of, doing secondary data analysis, doing other types of grants while you keep building the community. But I think really we need to sit down as a field and really think about it. And Academy of Health just published something today or this week talking exactly this, right? When the incentives are publishing and grants, etc., that's what you do instead of really thinking about the impact of your work.
Yeah.
So I'm sorry, you guys, I'm just reflecting on what you're saying, and I'm saying, yes, exactly, and I said,
but I do think there are so many pointers in the work that you and your colleagues have done about, I love practical papers, and your paper with Leo has so many practical pieces of wisdom in it. And as some of our audience members were saying, there's so much work we can be drawing on that we are not drawing on, that's been done for decades and decades in public health and other areas. And just bringing more of that work into how we design our studies, I think is going to be, one small but important pathway to, there's so many things we could do, but that's at least one way that we could say, I am not the first person to think of doing this by any means. I may need to stretch beyond my field, my discipline, my usual frame of reference, but it's out there. So how can I look at, an intervention, or maybe even something that was just not just an effective program, but it hasn't been through multiple RCTs, but it keeps going for years. It's sustained. What can we learn about, how it's sustained, and how we even think about something like sustainability with something that's gone on quite well and nicely without any implementation scientists involved. How does that, what could we, there's probably a lot for us to learn there. Yeah.
Perhaps the question is not how to implement, but rather how to learn.
Yes.
Yeah, it takes like a multi-level, multi-faceted changes to make an impact, like from policy. Yeah, we as individual can only do so much, but at least we're doing something.
Yeah, better than not doing something. We might have time. I think we have time for one more comment, which is from Joseph, and then we'll wrap up there. I just want to make sure folks see a couple of resources that you've provided for us, Anna. But before we go there, Joseph brings up that they're going to be adapting an intervention with a CAB in South Africa, and would love to hear models or ways others have used to engage CABs along the way beyond regular meetings. We have a wonderful relationship with folks who will serve on the CAB already. For me, CABs and their engagement is key to equity and addressing disparity. So any thoughts about that before we move to our conclusion?
100% agree. Leo Cavazza has a fantastic paper on this. I would look for his writings in how he used his board to actually develop a logic model, like an adapting an intervention mapping type of approach. So I would take a look at his work. I know that you need to close this, but I really want to reflect or one sentence on somebody talked about our values when we ask scientific questions. I don't think we can separate those. Your research question is based on your sociopolitical environment. And when I think about equity work, I think the conversation that we're having, right? The importance of actually engaging with the community and listening to the community is the most important piece, right? Because of assumptions like, technology will increase reach, and actually, right? So really learning how to listen, if you're interested in equity work, I think it's the most important piece. And being humble, because it hurts.
Right, and being able to be willing to have your values interrogated, I think, is a big part of it too, and that's part of that humbling process that you mentioned before, is just being able to hear that and exist in that discomfort, and use it as a motivating force.
Yeah.
Absolutely.
Yeah.
So thank you all so much for your great comments. And I saw the question about, can we make the resources available? Absolutely. What we'll do after the session is just send out a supplemented list of resources, because Anna, you brought up some great additional papers that we can make sure to send to folks, send the citations. The couple of papers we've mentioned today are here on this slide, and a great list of resources that Anna provided. And also Anna and her colleagues are currently doing a survey of folks' interest in trainings in implementation science and equity research. So the link is here, but we'll also make sure to send that out after the session. So I do want to thank you so much. I could seriously just sit here and chat with you all day. I wish we could, but it's been absolutely wonderful to talk with you and Chen Cheng and our audience. I do want to just give a quick heads up that we have some amazing beachside chats coming up with our more of our 3R Hub consultants. So next month, stay tuned for Jeff Curran. I can't tell you exactly what we're going to be talking about, but we are working on it, and it's going to be cool. If anyone knows Jeff, they know it's never dull to talk to Jeff Curran. And we'll be talking with Matt Chinman, who's also been doing really great work in the equity space, in April, and Russ Glasgow in May. So please stay tuned for our upcoming chats. And finally, I just want to beg and plead that you complete the evaluation that you receive from us. It's very important for us to know how these sessions are going for you and anything that we could do differently to improve them. It really helps us. It is super short. It's like 4 questions. It will take you less than 5 minutes, and it means a lot to us. Thank you all for those who completed it after Erin's beachside chat, and we would humbly ask that you do it again after today's session. So Anna, thank you so much for being here, for your wisdom, for your hard work, for your, I think as I said in a text the other day, your incredibly remarkable generosity of spirit, your commitment to doing amazing work and thoughtful work and hard work. And we're so lucky to have been able to spend this time with you. So thank you. And thanks for everyone who joined us today. Have a wonderful rest of your day.
Thank you.
Thank you. Bye, everyone.
Bye.